My name is Doris Ronenberg, and I'm an elder from the Saulteaux First Nation in northeastern BC, and my Indian name is Sisi Nsihkason Kanihiawihkoma. I think they're mostly younger, but by younger I mean from my point of view. They could be, say, 50 to a teenager, maybe 12, 13, 14. We used to be very active in that area, and one of our members wrote a book, David Hebert. He was quite honest about everything. And during that time, he had different people that were interested and became active. But today, we don't have that much activity. And I really feel that those people that have HIV should get together as a group to be a support group, but we don't have that. They welcomed David back, but it wasn't exactly with open arms to begin with, and because David had a different personality, but he did manage to make his place in the community. Like, it's a two-way street. Like, you can't, there's people that have personality conflicts, and they happen in any race. And you can't force things on people. You have to try to educate them. And see, how I got awakened to HIV and AIDS was through my niece. She got it from sharing needles, and she was only in her 20s, and she died from full-blown AIDS.
She did?
Yep, she did. And this was some years back. And that's how, it happens, when it happens within your family, then it hits home. And those are the people that they need to accept their people and try to be a support group to them. I think there were people that were uncomfortable because just go back, say, 15 years, the attitude towards HIV/AIDS was quite different than it is today. So there are many people that were uncomfortable, but because of his personality, he got over that. And the other people got over it too. They would be, yes, but nobody wants to come forward. And I'm sure there are people that are living with HIV. It would have to be a campaign because the band gets $1,400 a year for HIV/AIDS, and that's not very much money. And so I think you'd have to have kind of a big campaign just on the testing part of it. It's like anything else. Some of them are very receptive, others are not. I think so, and it depends on how it's presented. There's a worker in Montreal, and I met him at a conference, and he's worked in that field for probably 25 years, and he is HIV. And he gave some pointers and ideas as to how we could, work in that area so that it doesn't scare anybody, and that they realize that it is a health problem and they should deal with it. First of all, it's not people of my age and generation that needs to talk to the youth. It's a youth that has to communicate with youth. and then they'll most likely listen. Like at my age group, it's almost like you're telling them what to do. And we could help, like in the background, but youth has to deal with youth.